Welcome everyone to today's webinar. I am Mackenzie Bean with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. In about a week following the webinar, we will be sending all registrants a copy of the presentation to the email you used to register. Please be patient as the post-webinar preparation of materials can take some time. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Lori Condas is the Executive Director for the Office of Patient Experience for the Cleveland Clinic Health System. Working with the Chief Experience Officer, she provides leadership and directions for patient experience programs that have enterprise-wide impact in patient affairs, operations, and best practices. The Cleveland Clinic Patient Experience Department includes a diverse team of professionals with demonstrated expertise in service excellence, bioethics, spiritual care, healing services, volunteer services, best practices, data intelligence, ombudsman, end-of-life programs, healthcare communication, shared medical appointments, business development, and research. In collaboration with administrative and medical leaders across the system, Lori works to design, implement, and evaluate programs that improve the delivery of healthcare services and enhance the experience for patients across the enterprise. Mike Desimoni is the Senior Vice President of Strategic Marketing and Client Service at Verge Health. He brings to Verge more than 25 years of experience in the healthcare technology and data analytics industry. Mike has led data analytics, market strategy, client services, and product management divisions of McKesson and Best Doctors, as well as having built and optimized operational organizations with cloud-based technologies. Mike has a master's degree in economics from the University of New Hampshire. At this time, I'm pleased to turn the floor over to Lori to begin today's presentation.
Thank you. I appreciate the opportunity to hopefully have a discussion around how innovation and technology can really help us rethink and drive forward patient experience. And I would ask everyone on the phone that as we start the discussion, I would encourage you to pause for a minute and think about your own organization as I talk a little bit about our journey at Cleveland Clinic. I would ask in particular that you consider some questions, and these are questions that I'm going to cover from our perspective over the next brief amount of time. So I would think about, why do you want to improve patient experience? I would ask you to consider if this is a burning platform at your organization. Does your organization see value in patient experience? I would think briefly about, where did you start? What have you done to drive great experience? Has it been successful? Why or why not? We all need to fail forward and learn from our challenges. I know we certainly have. Think about what's changed in your time in this work. Has the healthcare environment moved significantly? Why are you potentially looking to innovate? Have you identified the problems you're trying to solve? And how do you want to move ahead? And who can help you get there? And then, what role should technology have in your work as you continue to move forward? And these are some of the questions or the way I frame some of our comments. So I would ask that you think about your own organization, and hopefully at the end we can have a little bit of discussion. And then to start, my final question is, what does patient experience mean to you? How do you define patient experience? How do you engage your caregivers around patient experience at your own organization? So for Cleveland Clinic, we define patient experience as both safe and high quality care, incorporating both engagement and experience, and really has to be engagement not only with our patients, but also our own caregivers. And then perhaps even more recently, we have to include making it affordable care. So overall, creating a high value proposition or high value care. And perhaps the thing that starts that this is a tricky conversation is that what creates high value care has changed And oftentimes it changes based on where the patient is in their journey with us. And for us, we've really looked at getting away from the concept of just satisfaction to really thinking about long-term loyalty. Satisfaction really measures only a small or specific moment in time, where if you think about experience, that really encompasses the complete set of interactions, the whole journey. And now we are really trying to think about creating loyalty, building relationships, and hopefully prioritizing positive encounters or journeys across that healthcare continuum. We know that we need to expand the thought about what drives that engagement or that journey. We need to make care accessible. We have a lot of work going on around access, but we also need to make health information accessible. We need to make sure that we're having those important conversations with our patients at every point in care so that they're well informed about the plan of care at any time. We need to actively work with a patient to coordinate their care. And perhaps the newer thing for some of us is we recognize the need to create ongoing or durable relationships that builds that loyalty. And our patients actually need us to anticipate both their clinical and their non-clinical needs. And as we work to meet these ever-changing needs of our patients, and also always incorporating our all-important caregivers, how do we incorporate innovation into that picture? And so I have another question for you. I'd ask you to pause for a moment and think about, what does innovation mean to you in your work specific to patient experience? If you were to get a picture in your head, is it a bright, shiny explosion, something that's never been seen before? Does it look something like this? A robot that's setting off a cosmic explosion, it's complete disruption, it's changing the way that we think about everything that we do. I would propose that sometimes we do need to be disruptors, but that sometimes, if we're not careful, that can also create some chaos. So I would also propose that sometimes innovation is not always creating a bright, shiny new explosion, but rather finding ways to adapt or build a good, solid practice to meet the changing needs of not only our patients, but our caregivers, and to meet the changing healthcare environment. And to really think about innovation as a way to create something that will be effective in the future to improve patient and caregiver experience. Sometimes I think it's blending human touch with technology. It's looking at technology as not only a solution, but can it be an enabler or an assist? In some spaces, this picture can be just the right amount of disruption or innovation to move us ahead, especially as we work on something truly transformative, if that's what you believe your organization needs. And I think it's always important for all of us to think about where we started. So I asked you that question about what have you done and what has been the impact. So I'm going to briefly, very briefly, tell you a little bit about our journey and where we started, going back to about 2009, even a little bit before that, where our previous CAO really put on the map establishing the patient's first culture. This truly was disruptive for us as an enterprise. It really focused on what was called the Cleveland Clinic experience. At that time, we were all designated as caregivers, so that was a much different way to look at who we were. A big focus on teamwork and the fact that we all needed to work together to create that Cleveland Clinic experience and that world-class care. It was setting expectations by senior leadership about demonstrating and resetting culture. We also put across a very significant impact through training and expectation on participation. At that time, every single caregiver enterprise-wide was expected to spend a minimum of half a day learning what it meant to be a Cleveland Clinic caregiver. If you were a surgeon, you participated. If you were a nurse, a physician, an EVS person, everyone participated, and you sat together with various members of the team to talk about what this meant. There also was an enterprise commitment for all of our physicians to be trained in communication, relationship-centered communication, through our READY program, and that was an enormous expectation because that took our providers offline for an entire day to learn how to communicate in the way that was determined to be important for our culture, and we also started heart training around service expectation. This was an enormous change and very transformative to the clinic. But things continue to change. Over time, since Cleveland Clinic Experience fully rolled out in 2010, we now do training differently to meet the ever-changing needs of our workforce, and we continue our journey so that we can continue to frame why this work is so important to us going forward and why we continue to focus on improving patient experience. We look at training now to think, how can we do training digitally so we're taking our caregivers out of the workflow for less time, but that doesn't mean we're not still focusing on the important work of patient experience. So we continue to ask ourselves, and I asked you that at the opening, why improve patient experience? Well, the Agency for Healthcare Research and Quality remind us that improving patient experience has an inherent value all to its own, to our patients, to our families, to our caregivers, so it's an important outcome in its own right. But oftentimes, honestly, those of us who focus on patient experience have had to identify other ways to build that value proposition. So the Agency for Healthcare Research and Quality go on to say that good patient experience also is associated with important clinical processes and outcomes. And there's other research to support that. In a recent Deloitte publication, The Value of Patient Experience, they shared that their results within that study show a strong association between high patient experience and quality, that in fact it's documented that hospitals with higher patient experience ratings have better scores for some clinical outcomes. For example, they show lower readmission rates. There's also a variety of studies that show that experience drives loyalty, and I mentioned earlier that we're really focusing on creating that loyalty or those patients that trust us with their care for a lifetime. There was a study from the advisory board that cited that hospitals could earn 50 times more revenue if you had a modest improvement in improving customer loyalty. And back to the Deloitte study, The Value of Patient Experience, they showed that improving experience can actually result in improved financial performance, so that there was a strong correlation between patient experience and the net margins that hospitals are able to maintain, which in this current environment is very important. So there's a lot of reasons to improve patient experience. Of course, the most important is that there's inherent value in doing what's right for our patients and our caregivers. So what we started to consider a couple of years ago is, when can we look at different ways to drive patient experience? How could we incorporate patients into their own care? That led us to look at creating healthcare partners, a different way to incorporate patients in everything we do. We now have patients that sit at high-level enterprise committees, including quality, safety, high reliability. Patients participate in design projects, designing facilities, designing care paths, and doing many other types of work where patients sit at the table from the beginning. We also know that we want to solve problems in real time, and that's something we're working to talk about now, and incorporating technology to help drive that is some of what I'm going to talk about. We're very focused right now on improving communications within teams. And we have a strategy that I'm going to cover now that we believe will really help to drive team communication, as we know that teamwork is the most highly correlated measure that we have to our HCAHPS to drive patient loyalty. We also knew that we needed to improve two-way communication with patients, but also a way to be able to track that communication over time so that we could show that we were starting to learn and know that patient. We continue to look at aligning safety, quality, and experience because we ask so much of our caregivers that we really were looking for was there one strategy that is an enterprise we could implement that could drive numerous metrics or numerous outcomes. And we really believe we've refined it down to a couple of core processes. And then also, how can you drive and sustain culture? It's that consistent approach. Oftentimes we drive those initiatives where you see maybe just a brief improvement, but then over time we see a lot of variability. So we really want to move that consistent approach. So we needed to think about who could help us. Who is going to be in it with us to do this work? The first answer for us is our caregivers, not just clinical caregivers, but this year we're really improving our emphasis on every caregiver has a part in creating a great experience, not only our clinical teams. But we also know that human behavior doesn't just change because you tell it it needs to change or because you give it another job to do. It changes because people find value and they decide to engage differently. So we needed to engage our caregivers and, more importantly, equip them, support them, and our patients. So I talked a little bit about partnership. We want to partner with those we serve to better design an experience of care. And this is actually a quote from our Chief Experience Officer, Adrienne Boise. We know that patients judge their care by what they feel, and we also know that their experiences are increasingly complex, and so we need to know our patients so we can respond to them. So the question continues to be, how do we improve patient experience? And there's increasing evidence that indicates we need to personalize interactions, we need to coordinate care, we need to empower our caregivers to identify and solve problems, and we do all of that by creating durable, ongoing relationships. I share this next great table from the advisory board, not because I think everybody should read everything on here in the moment. I would encourage you to look at it if you haven't, but to really show the complexity of this work. Healthcare preferences vary greatly by age, but I would also say that this might be one sort of faceted only looking at age. It also changes based on where someone is within their healthcare journey. So it just really underscores the need to find out what are some of those assists or other ways that we can connect with our patients to continue to be responsive and to maintain those relationships. So one of the strategies that we chose going forward is really to increase our emphasis on a variety of types of technology. There's a recent survey that asked healthcare executives about what is one of the top objectives that they're focusing on in the near term, and 42% of them cited updating technologies to improve patient experience as a top objective. It is definitely a top objective here as we're looking at opportunities to improve our technology infrastructure, looking at brand new ways to utilize technology, and reaching out to also bridge or connect technology with human touch. One of the ways that we do that is rounding. And I would say don't tune out, don't be disappointed. This isn't new or explosive. And please remember that innovation can happen here as well. Our enterprise right now is incredibly engaged around a new enterprise strategy that launched today, as a matter of fact, by our CEO this morning during Connection, around the importance of creating that human touch connecting with our patients to have that plan of care and to be able to continue communication with our patients and with our team. We also are working very hard to enable our teams, so blending technology with the human touch to really drive this strategy, because we hope and believe that this is one strategy that will have significant impact in different areas. So we believe that a technology solution connected to rounding is very important for our enterprise. We know, based on some of the literature searches we've done externally, as well as some of our own studies, which I will share briefly with you, that there's significant impact when we connect with our patients, if done well with rounding, on patient engagement or involvement of patients with their care, that we can increase our HCAHPS scores, that we can decrease safety events. We have a focus on length of stay and readmissions. We know if done well, rounding can impact that. And there's a significant caregiver impact around increasing engagement, providing opportunities to recognize teams, to increase accountability and trust, improve communication, another very highly correlated relationship with that loyalty, and then create meaningful leadership visibility for both our teams and our patients. One thing I realized that we left off this slide, which is an oversight of mine, is the really important measure of teamwork. We are really going to be measuring going forward as we focus on getting these teams to round together on the impact it can have on teamwork. We've heard some great anecdotal feedback, in particular from our nurses and our physicians, about the fact that having them round together at the bedside with the patient to hold these plan of care discussions has greatly improved teamwork on the unit level and respect for these caregivers of each other. We will continue to work on creating those very meaningful relationships for our team members and with our patients. And it also continues to emphasize the high correlation of communication in creating great patient experience. I'm going to share with you briefly some outcomes of some of the studies that we've done at Cleveland Clinic. This particular one was, we had one of our regional hospitals that really took on looking at leadership rounding to see if the leadership team went out, would it matter to our patients and would it help improve our patient experience? So what this shows is, and this is actual patient data, and it compares when daily leaders rounded with these patients, how did it compare with patients that were not visited by a leadership rounding team? They focused on asking questions, things like, has your doctor kept you informed? Do you understand your plan of care? Does the nursing staff ask you about your pain level? Are they helping you with your plan of care? What can we do to make your stay more comfortable? And you'll see in all domains that it drove, from a patient's perspective, above at least the 50th percentile, with the most compelling improvement in nurse communication as well as doc communication. Another study was rounding in the emergency department, and this was one of those studies where the results of this, I think, surprised all of us when we looked at them and we checked them and then checked them again. And again, what happened when the team was rounding with purpose and intent? So when they were going in and having purposeful conversations with patients about their emergency department visit, would it matter? And you can see here in this case, it drove all of the metrics well above the 90th percentile when rounding occurred, always rounded, versus just usually rounded. So there was significant impact here based on rounding. And then the impact of nurse rounding. So we saw from our patient perspective, and this was a fairly large study with over 15,000 people responding, that when the nurses always rounded every 2 hours, it drove every metric across the board over 90th percentile. When you compared that to usually rounded and then sometimes visited, this is our patient's perspective. And then finally, when patients felt like no one did purposeful hourly rounding, the impact that it had in a negative way, as far as how they responded, about how we communicate with them, our responsiveness, and also pain management. So we believe at the enterprise level, we made a case that rounding was important. Again, not something new and shiny, but what we also learned that oftentimes units shared with us when we asked them, we would say, are you rounding? And they would say, yes, we round. But when we in fact did observation or asked our patients, what we actually learned was that it wasn't always done with intent, and it wasn't always done with a conversation with the patient at the bedside. So we decided it was worth investing time and also technology. And so the question we posed was, how could we use technology to support our incredibly busy team? At Cleveland Clinic, we have something called Service Express. It's a great call center that is actually used by patients and also our own caregivers to share non-clinical issues. So you can call Service Express to say, a room's not clean, there's a leaky ceiling tile, for a whole variety of reasons. And so in 2018, we had close to 250,000 service calls to this particular Service Express line, which, by the way, doesn't even cover our whole enterprise. It only covers mostly Maine and some of our hospitals. So what we did is we then asked them, well, what % of those calls were made by our nurses? So what % of those calls were we requiring one of our nurses to actually step away and place a call about a non-clinical issue? We were not pleased and surprised to learn that of those nearly 250,000 calls, nursing was actually stepping away from clinical care 90% of the time to really make those calls, taking them away from bedside care. We felt like there was a better answer, and at this point started to look at, could we use rounding technology with the express ask that on the back end of it, we would be able to do service resolution. So could we put in their hands a way to round that they could very quickly indicate there's a service issue, and that the technology would send it where it needed to go and automatically escalate it to the right person, so that nurse could then move on and do the work she needed to do, and also would be able to track that issue if she needed to. It also would allow us as an enterprise to track issues and be able to theme them and trend them, so we could be much more proactive to help resolve those issues. It also allowed us to get in-the-moment feedback from our patients, identify issues that were occurring, and do in-the-moment recovery for service issues that came. Tracking trends, in-the-moment feedback, immediate issue resolution. And one of the things that we asked when we talked about designing this was also creating a history. So if this nurse goes and does rounding and she learns something about that patient that's important in creating that relationship, we wanted to be able to document so that we could share that with others during rounding. So during that round, if she learned something about that patient, maybe she learned that they had issues with food, not that that ever happens anyplace else, that's been a challenge with us, she could document that. And if someone else, a different caregiver, if I went on leadership rounds after that, if I opened up that app, I could see that, in fact, this patient really had an issue with food. And I could introduce myself, know who they are, and say, I've noticed you had some concerns with your breakfast this morning. Have we resolved that for you? Is there anything else we can do to help you? We really also asked that the technology have an HL7 feed so that it could pull data from Epic as you step on the unit, immediately populate and let us know who's on the unit. No one has to do a lot of data entry, but then be able to track that patient through their journey. So as others round, they really have that opportunity to create that connection. And it actually creates that history over subsequent admissions. So one of our nursing directors shared with me how pleased she was, especially for her oncology patients, because she said it was so great to be able to document things that mattered to them, because some of those patients are frequent admitters, that the next time they came in, they had the ability to reconnect on any issue or desire or anything that was populated that they could then talk to that patient or that family about the next time that they came in. So we really looked at blending experience and technology to also create great opportunities for patient engagement, to really get patients connected with their care. So we can change up the questions that are used in this rounding tool. One of the things that another nurse asked that was very important to them was, could they create questions specific to their unit? So as we trialed this with nurse managers, if they had an issue on a particular floor and they really wanted to focus on that particular issue, they have the ability then to go out and personalize those questions. They also, our nursing directors have dashboards so they can see who in fact is rounding, and then they can get information back from that perspective. We also wanted the technology to be able to be filtered, so you could say, hey, maybe I want to go round today on anybody who hasn't been seen previously, or even anyone maybe who's newly back from surgery. So we had a lot of different ways that we wanted to engage with our patients to get them involved in that plan of care discussion. We wanted to really improve communication, but also improve transparency. So we asked for a lot of dashboards so that we were able to then share on a unit level or an enterprise level information that would help us in real time and over time improve care. Get a vision of if a nurse leader was doing team rounds for that day, could they quickly pull up a dashboard and say, hey, we seem to have a lot of issues around whatever it is. So the team could very quickly in the moment say, hey, we need to find time in real time to identify what the problem is and to begin to resolve it. Again, collecting data for insights. We want to do some of our own internal benchmarking and maybe in the future be able to benchmark with other organizations who are like-minded. And then also it provides that opportunity again for auditing, for consistency, so that we can see whether or not these rounds are occurring and whether or not people are rounding in the way that we're asking them to round. Right now, our focus at an enterprise level, in addition to nurse rounding, purposeful hourly rounding, is actually rounding so that at least once a day, it is a caregiver and a nurse, or excuse me, it's a nurse and a provider standing at the bedside with the patient, having a discussion about their plan of care so that all team members are well informed about expectations for that patient. And then our nurse manager and purposeful hourly rounds can be utilized to gather data and information to allow us to do good service recovery and also to do a more proactive approach going forward. There's a lot more to consider around technology, and there's a lot of other things that we're working to incorporate. We also, when we looked for building this rounding tool, we asked for one platform that could also be used around compliance rounding, around safety and quality, and also around our ombudsman approach. We really wanted one platform so that we could begin to share and look at that data in a different way. So that's been a significant technology journey for us this year. We're also looking for additional opportunities to discuss cost transparency, maximize access and convenience, wayfinding, seamless payment process, communication, service recovery, empathetic communication, and certainly maintaining the relationship through customer relationship management. And we believe the rounding software actually is one step towards that relationship-centered management because it allows us to track that particular patient. So we know at Cleveland Clinic, we still have a lot more work to do around the use of technology. We viewed this over the last year as an important first step to really blending human touch and technology to really improve experience. We also really wanted to focus on how could we equip or put good information into the hands of our caregivers and help make their job easier using technology as an assist. I know there's some questions coming through, so I want to make sure I give both Mike time and then a chance to pause. I want to just briefly mention that we are so connected around innovation and technology that our summit this year on patient experience is very focused on innovation with a technology approach. So we hope that some of you will join us as a way to continue this discussion. We're going to continue to look at how can we use technology in the right way to improve patient experience going forward. So hope that some of you will join us for that ongoing conversation. And I think at that point, I'm going to pause there and turn it over to my colleague.
Lori, thank you very much, and I appreciate you going through the Cleveland Clinic experience. I'm going to walk you through a couple of slides of Verge and then really talk about our patient experience application and what we've done with Cleveland Clinic. Verge, our objective is we partner with our customers by providing the most comprehensive offering in the marketplace that's focused on safety, compliance, practitioner management, and we couple that with strategic advisory services. Our job as a partner is to ensure that we're supporting your journey and our customer's journey to high reliability. In Lori's presentation, she asked a couple of questions, and I have some as well. And, as an organization, do your goals for safety stay the same, year after year? If you have a multi-facility organization, are those goals the same or are they different? Are you collecting the data and information and being able to measure those goals? Right? Our job at Verge is to partner with our customers to ensure that not only do you have a system and technology that is helping you achieve your goals by measuring them, but our advisory services is ensuring that you have the right goals and at the right time, and that you have the right metrics to measure those goals. On the next slide, our objective, and Lori has hit upon this a couple of times. Lori, next slide, please, is the importance of technology and the human touch. We employ a systematic approach to evaluate risk in real time, which allows an organization to align people, processes, and technology. If you think of having the ability to react to what the patient needs right then and there, whether it's clinical or environmental, it's important to be able to minimize risk. It's important to understand what is happening real time and to ensure that your technology, but the people that are interacting with patients, interacting within an organization, have the right technology at the right time to be able to react and to be able to provide the necessary means for that patient and for their experience during any event that may occur. Next slide, Lori. Our goal with our partners is to build a platform for zero harm. Again, I ask a question, would you rather build a system that captures all the events that occurs, or would you rather build a system and work within a system that actually prevents an event from occurring? If you think of the points that Lori mentioned about building value, building loyalty, interacting with patients, capturing data, both non-clinical and clinical data and information at the point of occurrence, and being able to react to that. That provides, it provides an environment in which you're building loyalty and a patient is valuing the care that you're providing. But it's also building a zero harm environment, which is what we're all achieving and striving for here in healthcare. Next slide. So our objective, again, is we have a platform, and our platform crosses practitioner management, organizational compliance, patient and employee safety, all areas that Lori has mentioned. Our objective here, though, is to make sure that the functionality of that platform, so across all three of those, is that you have the ability to round, whether it's for organizational compliance and employee safety, practitioner management, you have surveillance tools across that, the ability to collect the data and information to analyze and measure trends, to be able to benchmark both within internal to your system, to your health organization, as well as external benchmarks. The value of that across a platform is extremely important, right? Lori has mentioned a few facts of action plans or being able to identify what needs to get done by whom, no matter whether it's found in the compliance side or if it's found in the patient experience side. The ability to build those action plans so people can react and positively impact an experience of a patient within the facility is extremely important to building loyalty and building value to that patient. So on the next slide, a lot of discussion around patient experience, blending technology and the human touch, right? Before we even developed the product itself, Verge partnered with Cleveland Clinic, where our product team, our development team, and the executives of Verge actually spent 2 days rounding at different facilities within Cleveland Clinic. And the objective there was to really understand what the people who were rounding, what they were doing, the nurse leaders, the nurses themselves, but also how they were interacting with the patient and building the relationship with the patient. One of the things that was crystal clear to us was that when the nurse or the leader was building that relationship with the patient, they wanted to maintain eye contact. They did not want to be looking down at a mobile device or looking at a computer and asking a list of questions. So in working, in partnering, we're able to develop an application, a mobile-friendly application that enables real-time issue resolution. We can capture issues, we can capture compliments, kudos that we call them, because there are many times in which compliments are given, and you want to be able to capture that and integrate with an HR system maybe to capture those values and those data. But it's also to be able to make sure if there are issues that we're resolving those issues in a timely manner that includes integration with other systems to ensure that the right people are doing the right work. On the next slide, Lori mentioned that 90% of their nurses were taking time to do non-clinical activities. Well, if you have a patient experience rounding tool that integrates with a work order system that can identify whether a ceiling panel needs to be replaced or a bathroom needs to be cleaned, and that work order is automatically generated in the facility system in which can be reacted on right away, that takes that pressure off the nurse to try to go to resolve that issue. It's automatically built in. The ability of the nurse to walk into a room knowing that patient was on the floor below them the day before, knowing that, as Lori mentioned, that they had certain issues, maybe they were medication, they needed an explanation of the medication that they were taking, so that the nurse could walk in and ask that question. I know you were on a different floor, but want to make sure you understand the medications you're on and the value associated with those medications. Having the ability to capture that data, but then to integrate with other systems, whether it be the EMR, whether it be the work order system, is extremely valuable to ensuring that the human contact, that interaction with the patient, is maintained face-to-face, eye-level to eye-level, while the technology behind the scenes is doing all the work for you. Right? And that is ultimately the objective that we had when we partnered with Cleveland Clinic. It was to develop a rounding tool that captured data prior to an event occurring, ensuring that patient was satisfied, that they were building loyalty, that they were building a relationship with the patient, and resolving items before they became a complaint or a grievance and became a bigger concern for Cleveland Clinic. Next slide, Lori.
That might be it.
I think, yeah. So, and again, it's for us. Our goal was to develop technology with Cleveland Clinic that only enhanced the human interaction and didn't take away from that. And again, things have been going really well. Lori and team has been excellent, and we're looking forward to answer any questions that you may have.
Wonderful. Well, thank you, Lori and Mike, for such an excellent presentation. We'll now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We'll try to get through as many questions as we have time for. And Lori, it looks like this first question is directed towards you. It says, we're a much smaller organization than Cleveland Clinic. How would you advise us to begin our PX rounding journey?
So I think we've honestly done it one unit at a time. So it hasn't really been, I don't know that, in some cases, I'm not sure scale always helps us because we have so many hospitals and so many units. And we really are focusing, even with our current emphasis, just really one unit at a time. We did a lot of our very early work. I didn't share some of the other work that we did at one of our local hospitals, Hillcrest. We started off just focusing on 1 or 2 units and really got sort of champions and people that could start that work and then roll it out, and then took our learnings and then really rolled it out more enterprise-wide. But honestly, we didn't start it off with a lot of people or a lot of resources. It was a very small team. I have Hope McIver in the office with me who project managed a lot of this. And at times she was like a force of one. So I don't think in this case our size particularly helped us.
Perfect. I think that's helpful for our audience to hear, so thank you. Another audience member wants to know, what kinds of technology are recommended for rounding? Are these particular hardware, accessories, devices, etc.?
I think, and Mike could answer maybe more of the specifics, but honestly, all of our leaders and all of our nurse managers have iPhones. Our frontline nurses do not, our bedside nurses do not. So they can also use iPads or other technology, but a lot of the tests that we've done or a lot of the work that we've done have been using iPhones, so both leadership rounding and for our nurse managers, but we do use iPads when we do leadership rounding at not all of our hospitals, but some of them, so we've also used iPads in order to be able to document the rounds.
And to add to Lori, and to add to that, as Lori stated, the technology needs to be flexible enough so that somebody who has an iPhone or an Android can use that versus a tablet or whatnot. And you know, our customers use varying types of technology, and you need to make sure that it is efficient and effective use no matter what their technology, no matter the technology they're using.
Great, thank you both for your responses there. Laura, I know you touched on how you guys started with a fairly smaller staff to get the PX rounding journey off the ground. This audience member is asking, what sort of staff does it take to handle 246,000 issues per year?
So first I have to apologize. My office is right by the ED, and one of our helicopters is landing. It may get a little noisy, so I'll apologize. The Service Express is really just a call center. So all they do is handle incoming calls and then triage them and route them out to the appropriate team that actually then handles that particular issue or request. I'm not sure what their total staff is, but it really is not a huge call center. They're relatively small. And again, what they do is they take incoming calls or emails and then triage them back out to the appropriate, if it's EVS or food service, for resolution. And so it's not a huge team.
Great, thank you for elaborating on that. The next question is, do you have reporting capability to show how many rounds are completed or the number of issues logged that were corrected or the average time to correct?
So Mike, do you want to take that?
Yes, gladly, Lori. So yes, the tool itself does have the ability to show the number of rounds completed and how often they've been completed on a patient, whether it be hourly or whatnot. It does also log the number of issues. It logs the number of kudos. I want to make sure we capture those because those are obviously good things that occur, as well as time to resolution and the ability to, in the average time, but also for a specific issue and incident resolution time. So it does capture all that data and information.
Great, thank you so much, Mike. The next question is talking about the finances of the system. And the audience member is asking, what is the cost to roll out this product, and is this sustainable?
The cost from our perspective is really based on the size of a facility and an organization, obviously. The rollout, this was designed to be able to be rolled out in a fairly simple manner. And I say that, Hope, Lori, may ask for your feedback on this, in the sense that we introduced this initially to just a couple of nurses just to get their feedback. And the feedback we received was, man, this was such an easy tool that we would like to include more nurses in this project, in this process, as we're going through the development process, because it was so easy to roll out. It really is self-explanatory. You do not need to be a technology wizard to use this tool. The objective from the Verge standpoint was, we know that nurses want to care for the patient. They do not want their head in technology. And so we try to develop an application that allowed them to do that.
And I think definitely, you can't see Hope, she's nodding her head. She's not speaking up, but it is very true. And also we had the great opportunity to work with Verge to really customize and design this. So in the early phases, they were very responsive to the nursing feedback and design features to make it easier for them to use, and to make sure that it had the pieces that mattered the most to our nursing caregivers, because that was really important to us.
Great, thank you both for clarifying that. The next question focuses on the implementation stage as well. This audience member is asking, should our hospital develop a solid leadership rounding method before investing in a digital rounding application, or will the rounding application help us implement a solid rounding method?
I think we definitely, I'm going to say for Cleveland Clinic, see the value in leader rounding. I don't know that necessarily one needs to precede the other. I think I will tell you, having technology that does a lot of the tracking is incredibly helpful. So in the past, not that long ago, I hate to say it for such a large enterprise, a couple years ago, all of our rounding was pen and paper. That's really painful for a very large organization, because then amazing people behind the scenes were then doing all the data entry. And to be very honest, we weren't closing the loop on issues. So for us, the reason that we value the technology is it makes sure we're not overlooking anything that's uncovered on leadership rounding, whether it's celebrating great things that we've seen, which are also important, or whether it's making sure that we're closing any issues that we uncover when we meet with patients. And having a technology way to be able to track that has been incredibly helpful. Some of our hospitals we're bringing up this across the enterprise, one hospital at a time. So I think it's much more time consuming to do it without some technology to support it. And I would stress that we believe leadership rounding is incredibly important. And in fact, it is something that is required for every hospital in the entire enterprise.
Great, that makes a lot of sense. Thank you, Lori. Another audience member is wondering, is this particular technology integrated into Epic?
So for us, it does have an HL7 feed, and Mike can talk more specifically. That was also a very important feature for us. So that what that means is that when you sign yourself in, obviously with all the appropriate security, when you sign in as a caregiver, and you tell it where you are, on what floor, it auto-populates not only patient name and room number, but we also define some specific fields that we wanted it to pull out of Epic to really enhance our rounds. And then Mike, please, you know way more about the technology. I know nothing, just enough to be dangerous.
Yeah. No, and that's actually a perfect explanation, because again, if you think of the nurse or you think of somebody walking into the room, the objective was we want them to have as much information in the palm of their hands as they could. So not only is it name a patient, room, as I mentioned, if they had been in the hospital for a few days and moved floors, that information would be there. The history associated with that patient would be there. If I were a patient and I was in last month, and I was dealing with something, you would have my experience from a month ago. So again, it was really focused on building that patient relationship so that there's loyalty, there's trust, and there's that positive experience associated with it.
Wonderful. Lori, let me direct this next question to you. The audience member writes, we hear from our caregivers that they are resistant to incorporating multiple devices into rounds. How have you been able to engage caregivers in this?
Well, you know, it's interesting, and we try to be very mindful to learn from our caregivers. And we had, I'm thinking of one nurse in particular who was pretty resistant to doing this. And so what she decided to do was, instead of entering it into the system in the moment, she does it after she leaves the room. And after she did that for a couple of times, she actually came in and said, you know, I thought I was going to hate it, but I actually really like it. So I think letting people use it, making sure that as you roll it out, we try to be really mindful to get their feedback and then adapt it whenever possible. And if you're able to show them that it has value, so we tried to build components that would have value. So for some of the nurses, you know, as they started using it, one of them said, I'm using it with multidisciplinary rounding now because it lets me track and trend. I think I mentioned earlier, one of our nursing directors, we had it in place for, I swear, like 30 minutes, and she said, oh my gosh, I can tell which one of my nurse managers is actually out there rounding. So it's finding those things that I think people find value. If we can show them, which we're going to be tracking, that it reduces the number of calls they have to make to request non-clinical service, that's value to them. And we really try and work very hard when we design things to always incorporate. We do human-centered design approach, so we always incorporate caregivers. And I think just making sure that it has meaning and it's helping them do their work. Anything we roll out, that we always try to incorporate that to the best of our ability.
Great, that's helpful for our audience to hear as well, so thank you again. The next question is about patient engagement. The audience member is asking, how did you involve patients in defining the patient experience? I would love to know if if you have any recommendations about how to practically engage patients in what creates a meaningful patient experience.
It sounds like it would be a really straightforward, simple question, but it actually isn't. And we have a really great team that focuses on our healthcare partner program. I do have to say that we do have very specific guidelines for how we interact with patients. They actually go through an onboarding and an interview process. We actually do background checks because we want to then integrate our patients into very high-level committees and other decisions. As we roll out new strategies, again, I think I mentioned they're involved in hospital design, they're involved in building care paths. We actually have a process to engage them. We've done projects on improving the way a bill looks. We've done projects on IT, did a huge project where we actually did some facilitated work where patients and then ITD caregivers came together so that they were co-designing the process that they wanted to improve. And so we use human-centered design really now with our patients to make sure that they're treated as 100% one of the most important stakeholders to have at the table every time. But we are very mindful about how we do that, and it did take a little bit of work on the back end to really create a pretty strong process for integrating patients into our work. And over the past probably year, we've increased exponentially the number of patients that are involved in our work as a result.
That's great to hear. Before we go ahead and end the presentation, I just wanted to turn the floor back over to Lori and Mike one more time to see if either of you had any final thoughts that you'd like to share.
Mike, you want to go ahead?
I can start, Lori, and you can bring us to the finish. Listen, I want to thank you all for participating. I think the importance, as you've heard, is it's the relationship with the patient and building not only the value and the loyalty and making sure the patient's heard, right? And the value of technology and that personal touch and how they can work together to drive that patient experience, to enhance and increase that patient experience. To me, that's what was important. That's what was important in doing the rounds with the nurses and truly understanding what a nurse does on a day-to-day basis and the impact technology can have both positively and negatively, and ensuring that we were having a positive impact on that nurse. So it's been a great experience, and we're really looking forward to more success and continuing to work with Cleveland Clinic.
And I think for us, it just really is making sure because we definitely are on a technology journey here, 100%. It's in our 5-year strategy. But we want to make sure that when we do, sometimes disruption is necessary, but sometimes it's not. So that we really are careful how we look at innovation and technology, and that we don't lose that human touch, and that we're always looking at technology that will decrease the workload and support our caregivers, not add to it. And that we never add technology just for the sake of being able to say we've added, we've digitalized something. So really focusing on our patients and our caregivers with what we do.
All right, well, that is all the time that we have left for today. I want to thank Lori Condas and Mike Desimoni for sharing their insights, and to Birch Health for sponsoring today's webinar. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.
Thank you.